Hello, my name is Chelsea Fitzhugh, and I'm a fourth year medical student at the University of North Carolina School of Medicine. I'm glad to present this project entitled Variations in Telehealth Use and Anticipated Future Needs by Practice Type in North Carolina. For some background, the COVID-19 pandemic has caused a rapid shift in maternal health care delivery, including the use of telehealth. Fortunately, prior studies have shown that telehealth can be an effective modality for healthcare delivery, but we do need more data in order to better understand the role of telehealth in maternity care delivery after the pandemic. The overall goal of this study was to explore the variations in telehealth use by practices in North Carolina for the provision of maternity care. Regarding our methods, first, we distributed a survey to all practices enrolled as NC pregnancy medical home providers following the onset of the pandemic. These surveys were collected by practice managers primarily through our web-based portal. Some were completed over the phone. The survey was designed using prior validated tools and with a survey methodologist. Data regarding current and future telehealth use and needs were compared by practice types, which were defined as county health departments, federally qualified health centers, community health centers, independently owned community practices, and health system-owned community practices. P-values less than 0.05 were considered statistically significant. Regarding our results, 111 of the 295 surveyed practices responded. These practices represented 75% of the North Carolina counties with maternity care services. So if you look at Figure 1, that's 75% of the counties highlighted in blue. In regards to the characteristics of practices surveyed, seen in Table 1, there was a nearly equal representation from metropolitan and rural or micropolitan counties. The vast majority of providers in these clinics were general OBGYNs or APPs. Most practices identified themselves as county health departments, 38%, or health system-owned community practices, 33%. Also to note, most practices served a large population of patients with Medicaid. In Table 2, when examining telehealth utilization, a total of 10% of practices used it prior to and during the pandemic, while significantly more, 64%, reported telehealth utilization exclusively after the onset of the pandemic. While county health departments were the most represented among our surveyed practices, they reported some of the lowest telehealth adaptation before and after the onset of the pandemic. Also notably, the greatest increase in pandemic-related telehealth use was seen among health system-owned community practices. When evaluating future telehealth needs, assistance with patient accessibility and remote monitoring were the most commonly cited needs. As you can see in Table 3, telephone visits were the most commonly adopted telehealth modality. Ultimately, there were no significant differences in anticipated future telehealth needs by practice type. 104 practices reported future interest in telehealth options. 46% of those practices reported interest in an MFM hotline, and 44% reported interest in MFM teleconsultation services. In conclusion, the COVID-19 pandemic has been associated with increased telehealth use among all practice types providing maternity care in North Carolina. Expansion of MFM services must address the anticipated future telehealth needs, which are independent of practice type. This concludes my presentation. Thank you so much for your time.